Hello friends, you are welcome back to Get Med Tips. On this channel, we produce and upload videos that treat common medical conditions and their ways of prevention. In today's video, we will talk about tetanus. With the following outline: what is tetanus, about the organism, the classification of tetanus, risk factors, pathogenesis, clinical features, and the tetanic triad. So let's get right into it. What is tetanus? Tetanus is a neurologic disorder caused by a neurotoxin called tetanospasmin, produced by the clostridium tetani, and is characterized by increased muscle tone and spasms. Note that there is no involvement of the brain in tetanus. It affects the spinal cord. Tetanus is the only vaccine-preventable disease that is not communicable but acquired via environmental exposure to the spores of Clostridium tetani. About the organism. Clostridium tetani is a long, thin, anaerobic and motile gram-positive rod that forms an oval, colorless, terminal spore and assumes a shape resembling a tennis racket or drumstick. It is a ubiquitous organism found in soil, animal and human feces, dust, dirt, inanimate environments, and in contaminated street drugs like heroin. The spores are extremely stable and may survive for years in some environments and are resistant to boiling for 15 to 20 minutes and to the usual antiseptics. Classifications of tetanus. Tetanus can be classified into local tetanus, neonatal tetanus, generalized tetanus. So local tetanus is a rare form of the disorder with clinical manifestations restricted to muscles close to the wound. It has a good prognosis. Note that cephalic tetanus is a rare form of local tetanus that follows head injury, facial trauma, or ear infection. It has a poor prognosis and a high mortality rate, and commonly affects one or more cranial nerves, most commonly the facial nerve. Neonatal tetanus is a severe form of the disease, often fatal form of the disease seen in neonatal age group and is associated with non-sterile delivery and cord care practices. Generalized tetanus. This occurs when toxin released in the wound enters the lymphatics and bloodstream and travels to distant nerve terminals. There is generalized spasm and muscle contraction in all the affected areas. This is the most common form of the disease. There is also a classification by severity. We will talk about that after going through the clinical features. Risk factors of tetanus. Unclean delivery, unclean severance of the umbilical cord, unattended pregnancies, pregnancies attended to by untrained midwives, failure to immunize before or during pregnancy, home or roadside deliveries, deep wound, example punctured wounds, abrasions or laceration, necrotic tissue, high temperatures, high humidity, common in areas where soil is cultivated and more in males. Pathogenesis. Clostridium tetani produce two exotoxins, tetanolysin and tetanospasmin, at the site of inoculation. Tetanolysin is a hemolysin which does not play a role in the pathogenesis of tetanus. Tetanospasmin is a powerful selective neurotoxin which is readily diffusible water-soluble protein. From the point of inoculation, the tetanospasmin travels in the alpha motor fibers and accumulates on the motor neuron. In the anterior horn of the spinal cord, the toxin is taken up by the presynaptic terminals of the inhibitory spinal interneuron, preventing the release of inhibitory transmitters, especially glycine and gamma-aminobutyric acid. This results in the excessive discharge from the alpha motor neuron, causing uncontrolled spread of impulses, hyperreflexia, and constant muscle contraction. Natural tetanus infection does not confer immunity. Clinical features: sudden inability to suck in neonatal tetanus, or inability to open the mouth due to spasm of the masseter muscle causing lockjaw or trismus. Stiffness of the body, generalized spasms, difficulty in swallowing, rhizus sardonicus or Sardinian grin due to spasm of the facial muscles, apnea, asphyxia, cyanosis due to spasm of the respiratory muscles, opistotonus due to generalized muscle hypertonia affecting the trunk muscles, rigidity of the abdomen due to spasm of the abdominal wall muscle, high temperature more than or equal to 40 degrees C have been recorded, diaphoresis, high blood pressure, and tachycardia. The tetanic triad. The tetanic triad is a combination of 3 features. They include lockjaw, rhizus sardonicus, and opistotonus. Thank you for watching. Have a wonderful day and stay safe.